Okay, let's go to emergency for, acupunctures for emergencies. And this time we'll talk about stroke, its etiology and pathology. Let's begin. So, stroke is a condition characterized by sudden loss of consciousness, hemiplegia, numbness, dry mouth and tongue, and dysphagia or aphasia. Depending on the extent of injury to the brain or meridians, it may be classified into two kinds: that involving the meridians and that involving the viscera. So let's talk about the etiology and pathology. So stroke develops in the patient when chronic dysfunction of the visceral organs leads to Qi deficiency and blood insufficiency. In this state, a number of processes can result in disordered movement of Qi and blood and give rise to endogenous wind, fire, phlegm, and blood stasis, thereby causing blockage of or extravasation of blood from the cerebral vessel. So these processes include the following: excessive fatigue injuring the interior, melancholic brooding or excessive rage, dietary overindulgence or overtaxing physical activity leading to blood stasis and blockage, internal accumulation of phlegm and heat, yang transforming into wind. Now, in all these cases, cerebral vessel blockage or extravasation of blood can lead to coma and partial or total paralysis. Now, cumulative deficiency of genuine qi. Senescence may reduce yang qi to as low as half of its normal level. Chronic illness with a weak constitution also results in deficiency of both qi and blood. Regardless of its cause, deficient qi loses its motive force for blood circulation, so that blood becomes static and forms clots that block cerebral vessels. Now, immune deficiency, yang become hyperactive so that endogenous wind stirs. Now, this in turn causes qi and blood to move abnormally, carrying phlegm and blood clots to attack the orifices and cause a stroke. Now, for intemperate diet, overindulgence in alcohol or fatty and sweet foods or obesity with impairment of qi actions may impair what? The spleen functions, obviously. Now, spleen dysfunction allows endogenous dampness in phlegm to form and accumulate. Gelling of phlegm transforms into heat and induces the stirring of liver wind. Erratic wind, in turn, attacks upward and disturbs the channels in meridians, causing blockage of the orifices and inducing stroke. Now, injury by passion. Unregulated passions can lead to stagnation of liver qi and blood stasis in the cerebral vessel. Strong rage can injure the liver and cause sudden hyperactivity of liver yang and blazing of heart fire. Wind and fire interact and readily cause qi and blood to move erratically. If this erratic movement of qi and blood disturbs the brain, a stroke may result. For physical exhaustion, this would lead to impaired regulation of yang qi, which may then rise upward and cause wind to stir. Phlegm and static blood move upward, carried by ascending qi and fire, and disturb the upper orifice. This may also cause a stroke. For the exogenous pathogen, deficiency of genuine qi makes the patient highly susceptible to attack by exogenous pathogenic evils. Now, in this state, the exogenous pathogen may induce the stirring of phlegm and dampness or stagnation of qi and blood by direct attack on the meridians. In either case, blockage of cerebral vessels may ensue, ensue and lead to a stroke. Now, the location of a stroke is principally the brain, but the heart, liver, spleen, and kidney are also affected here. Broadly speaking, the pathological mechanism of stroke falls within the following six categories: deficiency of the inner chi, fire of liver or heart, wind of liver or exogenous pathogens, phlegm with wind or fire, chi for abnormal movement, and blood for stagnation. Any of them can interact and influence any other. Interesting, right? Thank you so much for listening.